I think some of the misinformation out there, of course, is that that the way to resolve an ectopic pregnancy is not an abortion, but obviously from the Catholic perspective, and here I put my bioethical hat on, obviously we know that there are ways that it can be done ethically, and there's ways that it is a direct attack on the baby. So I think that, especially as Catholic institutions and ethical professionals, medical professionals who can speak into this, is to show that obviously there's sometimes that, for example, with let's say, for example, with ectopic pregnancy, to differentiate between that, between a direct attack on the baby versus you know, it being a secondary action against, and that is not directly intended to kill a baby. So I think that as far as possible, especially as these bills are being considered, that it is an opportunity for people in ethics to help with the language, with that bill language. But as we know, the biggest talking point and the biggest messaging point is that abortion is never necessary. So to show that, you know, sometimes with ectopic pregnancies, for example, that ectopic pregnancy resolves itself, but that there are also ways to ethically handle an ectopic pregnancy. In terms of practical legislation, the one that comes to mind, and I think it could get bipartisan support, is to fund pregnancy resource centers and supports for mom. It seems like a no-brainer that, for example, even if, let's say, in a pro-abortion majority state, let's say that they don't necessarily want to fund pregnancy resource centers, even though I think that we can get that passed in a lot of states. They could at least say, we'll give more funding for social services for single moms, for adoption or foster care, for homelessness, et cetera. So I think that is a way to really engage with the other side, and to say, look, you care for women. Here you have a lot of women who could use these services. So I would recommend to start there, because with a lot of these federal bills right now, they're not getting passed one way or another. For example, one big threat is the Women's Health Protection Act, which, if a Congress looked differently, that would codify abortion across all states. On the other hand, if Congress looked differently, we could potentially pass a no taxpayer funding for abortion or a pain capable bill, et cetera. But I think that at the federal level right now, it doesn't seem like we can do as much on those issues, given the current state of the makeup of Congress. So I start locally, again, start at the state level and see what things you can get bipartisan support if possible. And I think that the way that Texas has done it has been amazing. And I think other states, especially start with the low-hanging fruit, start with the states that are already pro-life, that have the support, and introducing those types of bills will vastly help women, as we know that pregnancy centers have a lot of extra clients, especially not only abortion-minded clients, but angry women who are kind of caught in all of this. And so I think just making it easy for them to support women would be the most effective way to make a difference. And going off of what was already said, it's also important for us to help whatever way we can, whether it's volunteering or monetarily, but also some of these pregnancy centers will need legal support. So if you're a lawyer, or if you're a doctor and they need some medical support, those are ways that we can take action right now, even apart from the political process.